Hi, this is Dr. Doerr for Functional Soft Tissue, and this is going to be our rehab video for Condition of the Month for Achilles tendinopathy. And what we're going to demonstrate here is two different exercises. One is going to be directed towards the Achilles tendinopathy, and the other exercise is going to be directed a little bit more towards mobility for the ankle mortise joint, as well as some proprioceptive activity for the foot and lower extremity. So the first exercise we're going to do is associated with an eccentric load on the Achilles tendon. And the importance of the eccentric load, as we've discussed before, is going to be a greater collagen synthesis associated with the fibroblasts that we've brought to the area associated with our factor treatment. So in this situation, we're going to look at it from twofold. We're going to also look at the gastroc, and then we're going to look at the soleus. So with the eccentric step, frequently we've talked about eccentric loading and only eccentric loading with the Achilles tendinopathy, but I'm not going to be shying away from the concentric. I just want to make sure the concentric load is only about half as long as the eccentric loading. So if she goes up on her toes in a count of 2, we want to make sure it takes a count of 4 to come down. So our patient is now going to go up on her toes, and she's going to get the weight off that one leg and now slowly drop down. And then at the end, you'll notice that she holds that position for a little while to make sure we get a really good stretch along that gastroc and the Achilles, a good eccentric load, and then she's going to come back up and drop back down again. And what we're going to do now is we're just going to focus on changing from gastroc to soleus. So she's going to go back up on her toes, and now when she puts the weight on the other leg, she's going to put a little bend in the knee, taking the gastroc out of it, and now this allows for the soleus to be isolated on the eccentric load. So once again, come all the way back up, bend the knee, and drop down. Okay. Now the next exercise that we're going to show is going to be associated with the BOSU. So we're going to move our patient off of the step. And the importance here is making sure our patient's nice and balanced. She's going to spread her feet to a little bit more than shoulder width apart. And using the BOSU, we can use this just like we would a wobble board. So our patient's going to try and touch both ends of the BOSU all the way back, putting her into dorsiflexion, and then all the way forward, putting her into plantar flexion. Now, as she comes all the way back, an important thing to realize is she may lack mobility at the ankle mortise joint. So in these situations, what we can do is give an assist, locking right onto the talus, and as she comes forward, there's no pressure on the talus, and as she starts going into dorsiflexion, we can give a posterior glide, assisting in a talus posterior translation. And again. And 2 more times. 1 more. Okay. Now, big thing with this one again is we can do our dorsiflexion and plantar flexion, but this also allows us to do inversion and eversion for a little bit more of the ankle sprain scenario that we'll do, as well as circumduction, which is general mobility of the entire ankle. So once again, the BOSU we can use for both mobility. We're going to get stretching as well as contraction of all of our ankle stabilizers because of the proprioceptive aspect of it, as well as the assist in mobility at the ankle mortise joint associated with a posterior talus glide on dorsiflexion. Big thing again when we're doing this exercise is we want to make sure the patient doesn't lose stability within the lower extremity. We want to see her be able to keep a good core rotation or a good core mobility with her spine. We don't want to see her flex in order to achieve the motion, or bend the knees or flex at the hips too much. And we want to make sure the feet are able to stay on the ground well while she's doing mobility as well. So let me have you step off here. Good. And remember, with the eccentric load associated with our step exercise, we're going to use that one more for collagen synthesis and remodeling of the tendon. And for this one, a little bit more of a proprioceptive exercise as well as a mobility exercise. Remember, with the eccentric step, our protocol is going to also be at home. We're going to try and have our patient do this twice a day, anywhere from 15 to 30 reps. And once that exercise creates no soreness, either post-exercise or during the exercise, or there's no soreness the next day, we can actually increase either the reps, get to sets of 30, or we can start using a backpack with weight to increase resistance until there's no soreness with that. That's a good sign that the patient's actually fully healed and is ready for a return to play. Once again, I'm Dr. Doerr for Functional Soft Tissue, and this is our rehab video for Condition of the Month for Achilles tendinopathy.